like we have a group of facilitators who will take us through the COVID-19, this webinar, and may I request them to just open their camera and say hi to all the participants joining. So can we start the introduction with Dr. Bhanu?
Good afternoon, colleagues. I hope you can hear me. This is Bhanu Pratap. I'm the Senior Officer for Care in the Communities and the Global Focal Point for Healthy Aging at Health and Care Department in IFRC Geneva. Nice to be here. Thank you.
Thank you, Bhanu. Can we have Margarita?
Yes, hello everyone. I'm Margarita. I work with Banu in Geneva, and I will be doing the technical administrative things in the platform. So I hope everything goes well and have a good webinar, everyone.
Thank you, Margarita. Chica?
Yes, hello everyone. My name is Chica. I work at IFRC Geneva with Banu as an intern. It's nice to see you all here today. Thanks.
Okay, thank you, Chica. Now let's come to, I think I have not missed anyone from Geneva. Let's now come down to Asia Pacific. So we have John Fleming.
Hello, everybody. This is John Fleming. I'm the head of regional health, the regional health unit in Kuala Lumpur. So nice to be engaged in this, and thank you for all joining. Thank you.
Thanks, John. We have Nagore.
Hi everyone, I'm Nagore. I'm the Regional Protection, Gender and Inclusion Coordinator in
Nagore, can you please speak close to the mic? It is a bit distant.
I have headphones. Can you hear me now better?
Yeah, yes, thank you.
Okay, so I am Nagore Moran. I am the Protection, Gender and Inclusion Coordinator for Asia Pacific based in Kuala Lumpur. Happy to meet you all.
Thanks, Nagore. We have Nadira.
Hello everyone, my name is Nadira. I am the Regional Community Health Officer based in Kuala Lumpur. Hi.
And then we have Jessie. Jessie, are you in the call? Okay, I think she has some technical difficulties to get in. And myself is Dr. Abhishek. I'm the Regional Emergency Health Coordinator, and I'm based in Kuala Lumpur. So as usual, let's start.
Hello. This is, excuse me. Yeah, this is Musharraf Hussain Khan, CE Officer, Bangladesh Red Crescent Society, Dhaka.
Okay, thank you. So let's.
Sorry, can you unmute yourself? We cannot hear you. Go ahead.
Okay.
Yes, go ahead.
So I'm going to share my screen. Please do confirm if you can see the screen.
Confirm, we can see it.
Yes,
okay.
We can see it.
Okay, so let's go through the agenda that we have for today. We will have a brief update around the COVID-19, like how the virus is evolving in the region. It will be then followed by a presentation from Dr. Bhanu around the older people and COVID-19 key challenges, the questions we might have, etc. around that. You'll give a basic overview around that. It will then be followed by like introduction of the older people guidance note, the interim guidance note that was developed, followed by a quiz and a small summary by Chika and Bhanu. Then we will go to the breakout session. Margarita will give us a brief update regarding those breakout session, and the session will be moderated by 4 facilitators. Group 1 will be with me, Group 2 with John, Group 3 will be with Bhanu, and Group 4 will be with Nadira, Chika, and Nagore. And then we'll have like around 15-20 minutes discussion. We have 3 questions there, and it will be then followed by overall presentation, what was the outcome of our group work, and then we have some chance to ask some question to our experts, and also there will be a final remark from John Fleming to close the meeting. So let's start the webinar with a brief update how the COVID-19 is evolving in Asia Pacific. As you have been observing the Asia Pacific dashboard, we now know that there are at least 27 countries in the Asia Pacific which have confirmed cases of COVID-19, with 3 countries, namely Bangladesh, Indonesia, and Philippines, with community level transmission. The number of confirmed cases is closing to 1.5 million, and we have more than 38,000 deaths in the Asia Pacific. In terms of, if I compare it with the global picture, Asia Pacific harbors around 60% of the global population and have some of the big migrants group and vulnerable population here. There are countries with conflicts, etc., and other vulnerabilities, but we are at this time having around 10.56% of the global burden of COVID-19. But the pictures is quite rapidly changing in Asia Pacific as such. In terms of the testing, which remains one of the major concern in Asia Pacific, as countries like Myanmar, Indonesia, Pakistan, Nepal, and Afghanistan really need to scale up its testing capacity to understand the true scale of COVID-19 in these countries, stating that, however, we have seen in last few weeks that the testing have really increased in the Asia Pacific region. One of the striking thing that is really happening in Asia Pacific is by the end of May, we have around 10,000 cases per day. But now when we come to end of June or early July, we're constantly having more than 30,000 cases per day. And out of those 30,000 cases, more than 20,000 belongs to India alone. And India, if you have been, I'm sure, following the news, now India is ranked 3 in the world with number of confirmed cases. It has just surpassed Russia yesterday evening. So the cases are really changing in Asia Pacific, and we are more vigilant as we know the cases are increasing in countries with weaker health system like Afghanistan, like Pakistan, Bangladesh, and Nepal, where as per the Informed Risk Index, the health capacity is not very well developed, and the health and humanitarian impact of COVID-19 will be more grave in this country compared to what we have seen in Australia, New Zealand, and Japan, which have a very good health system. So we are also a bit concerned on increasing cases in these countries and are trying to put all possible efforts possible to suppress the virus in this country. These are some of the important website we have, and we have been promoting all through the webinars, like the Health Help Desk, IFRC Go platform, and Asia Pacific dashboard. And there is also a Soconi platform where you can really go and browse and have some of the critical information, updated information, and the tools that will help the National Society to implement programs around COVID-19. So this is just a brief snapshot around COVID, how the virus is evolving in the Asia Pacific region. And now may I invite Dr. Bhanu to just give a brief update around COVID-19 and working with older people. Thank you, Dr. Bhanu.
Thank you, Abhishek. Let me just share the slide. Can you see the slides?
Yes, perfect.
Yes.
Perfect. Okay. So this is Bhanu, as I introduced myself earlier, and this presentation, I'll be taking us through the situation and impact that COVID-19 has on older people. And I just want to take this opportunity to say thanks to Chika, who also has supported me in developing this presentation. So we know that populations are getting older overall. The world is getting older. The number of people aged 60 years or older will rise from 900 million, which is like 12% of the world's population now, to 2 billion, which will be around 22% which, in the course of next 30 years. So these two maps, if you can appreciate this, these two maps shows how the populations are changing in different countries and in different regions around the world. In Asia Pacific alone, out of 900 million, as I mentioned now, the number of people over 60 years are already 630 million, which constitutes more than 58% of the older population in 2020, and in 30 years this will be 1.3 billion. So every fourth person in Asia Pacific will be over 60 years of age in 30 years time. We also know that population aging is happening much more quickly than in the past. So basically, for example, the France, Sweden, and the UK, I mean, they almost had 100 to 150 years to adapt their systems, their policy, their programs, or their health and care systems to a change from, say, 10% to 20%, which is like doubling the age of the proportion of the people that was older than 60 years. And the places such as China and India, we will have slightly more than 20 years to make the same adaptation. And I just want to reiterate here that there is no typical older person. So biological aging is only loosely associated with person's age in years. So I'm definitely talking a lot about more than 60 years, more than 80 years. But then I personally know that that lot of 60 years old or even 80 years old have physical and mental capacities similar or even better to many 20 years old. So as Abhishek has already gone through the global COVID numbers, I'll just quickly run through what the numbers and other things have an impact on older people. So we know that the data and evidence clearly indicates that, you know, in our countries, the older adults and the people of any age actually who have underlying medical conditions, maybe cardiovascular or the heart diseases, diabetes, high blood pressure, lung diseases, or cancer, they are at higher risk for developing the severe illness from COVID-19. A range of physical and social factors make the older people even more at risk or vulnerable. So in terms of the physical factors or the reasons, the natural aging process, as we know, is associated with decline in some immune functions and the functional ability. So weakened immune systems may make some older people more vulnerable to contracting the secondary infections or bacterial infections and less able to make full recovery from the illness. And in terms of social factors, older people may be living in poverty, you know, dependent on family members for care, live in crowded spaces or institutions like nursing or retirement homes, or the places where they are provided with long-term care, where implementing the physical distancing measures may be difficult or even impossible. Again, I want to reiterate that older people are incredibly diverse as a group who are not uniformly vulnerable to the impacts of COVID-19. Some older people will be more at risk than the others who have better health functions and who are more active. Yeah, so we are seeing that, you know, I mean, that during COVID-19, the fatality rates are we have found that they are even 5 times higher than the global average. We also know that older people are more likely to have one or the other kind of underlying conditions, as I mentioned, diabetes, cardiovascular, lung diseases. And 66% of the people who live over 70 years have already at least one underlying medical conditions anyways, globally. And out of the 10 deaths that have occurred in older people, they have occurred in individuals who had at least one underlying conditions. So this chart actually shows that, you know, I mean, that how the death rates have increased in terms of proportion as the age increases. So some of the key challenges that actually older people and the organizations like us actually are facing who are working in the communities. So we know that, you know, when I was developing this presentation with Chika and my colleagues, we could not find sufficient data. So there is quite a lot of a mix a missed data opportunity where we don't have we have insufficient age and sex segregated data. The services are not available, and if they are not available, they are not accessible because of either they are very far from the places or just because of the mobility of the older people themselves. And the services, we know that, I mean, the physical, mental, and psychosocial needs actually have increased even, during the lockdowns, and the services are not available. And then the policies are as I said, that the policies are just not existing or are inadequate taking care of the older people. And then even if the policies and the programs are there, we often miss the consultation and involvement of older people in the development of the policies, in the development of the programs, and also a lot of guidelines which are available, and we just don't actually we lack that part of mobilizing the community, participation of the older people. And then we are also seeing some of the quite a lot of increase in ageism. Ageism is the stigma, discrimination, and prejudice against the age, basically against the older people. This is even, some studies from WHO suggest that this is even more prevalent than the racism and sexism in many parts of the world. So as I was mentioning, that the more severe the transmission phase of COVID-19 pandemic is, the underlying medical conditions actually take a toll. So, but we also see that, I mean, as the severity of the transmission phase increases, the more and more NCD services, the non-communicable diseases services, are disrupted. So this is just a chart from WHO where it shows that if we move from phase 2 to phase 4, the services disruption for even the high blood pressure or the hypertension management also increases from 41% to 64%. So basically 2/3 of the countries actually have the disrupted services for high blood pressure if we are in community transmission phase. And likewise for diabetes, from 1/3 of the countries having the disrupted services, it increases to again 62%, which is again more or less the one-third of the countries who cannot provide the regular diabetes management and the treatment. So the COVID-19 pandemic once more underlying the need for promotion, provision of care and support both at the community and the care level, implementing the healthy lifestyle and the healthy aging programs, providing more community-based mental health and the psychosocial support. I was talking about ageism. So basically, we know that, I mean, the many countries around the world have implemented the lockdowns, the stay at home or physical distancing measure. And as I said, that in some places, the older people may not be able to actually have the physical distancing themselves. And also it has changed in many aspects in the world that how the older people are treated. So before COVID, WHO actually conducted a global study where IFRC was a part of. And in 2017, we came out with a data evidence where every sixth older person was subject to either abuse or neglect or some kind of violence. But during COVID-19, the records from the helplines, the police forces, they clearly indicate that there is a huge increase in the reported cases of domestic violence, abuse, and neglect. And in some settings, actually, this has increased to 10 times in terms of abuse and neglect in the older people. And again, these numbers do not represent the prevalence of the problem, as we know that most cases are not reported to the services. And although they are less reported, the combination of increased risk of violence and neglect and abuse and reduced ability to obtain the help during the COVID-19 pandemic compounding is likely to be similar of older people experiencing the abuse. And mobility issues also can limit, the opportunities to seek help. Yeah. So we are also seeing in in the public discourse that the media is also, portraying the older people, or especially the people over the age of 60 or 70, as being helpless, frail, and unable to contribute to the society. So these views are being spread in the social media, in the press, in the public announcements by the government officials. You can see on the right side the table 1, where we have some illustrations of how the older people are portrayed in different media sources. So what we as Red Cross and Red Crescent are doing, and what are our priorities? So basically, we are still following the life course approach, working with national societies around 4 areas. First one is providing the technical and programmatic support, working with national societies in different regions through the provision of, I always say them, enablers, basically providing the systems, the tools, the guidance, building capacities, launching some online courses, considering that we can't have the physical trainings, promotion of intergenerational solidarity, basically bringing the different generations dialogue more openly, so that the different generation, the younger generation and the older people, learn from each other. We are seeing an increase in, for example, in many countries, that older people have actually now learned a lot in terms of how to use the mobile technology, how to access information from internet. We are also working with our colleagues from PGI, the Protection, Gender and Inclusion, and I'm very happy to see Nagore there in Asia Pacific, but also we are working in Geneva and in other regions, PGI colleagues, the CEA teams, the Community Engagement and Accountability, and the RCCE teams to support in development of anti-ageism policy plans actually, and the programs focusing again on stigma, discrimination and prejudice. And we are working with internal and external stakeholders to position the Red Cross and Red Crescent movement, actually advocating what we have been doing and highlighting the good work of national societies. So in the end, I just want to actually present some of the tools that are available. We just have launched, we launched 2 months back, the interim guidance for the Red Cross and Red Crescent staff and volunteers who are working with older people during COVID-19. This provides recommendations on different elements of that we should not be missed. We should not miss when we are working with older people, or we should take into account. This guidance was developed by not only by Health and Care, but PGI, RCC, CA, and different regions, and even the national societies from different regions. And then there are other toolkits and the courses that are available. Some of them are community-based and some of them are home-based care. So please do visit these websites. These are available on, all the resources are available on IFRC website, on FedNet, on the Health Help Desk, and the Go platform. And we will be providing these presentations and the links afterwards also. So this is from my side. I remain open for questions, or we can go to the breakout group. Thank you.
Okay, thank you, Dr. Bhanu. Let's reserve the question for the end. I'm sure people have some question around this interesting facts and figures that you have presented, and the tools that you have presented, and how the National Society can use these tools. Let's now move to the next agenda item, which is, I think, the introduction of the interim guidance, and also it will be followed by an interesting quiz. Over to you, Chika and Dr. Bhanu again.
Thank you, Abhishek. So now we're going to move on to the quiz, a short quiz on the interim guidance on working with older people during COVID-19. As Bhanu said, the guidance was developed in partnership with teams across health, PGI, RCCE, CEA, and National Society colleagues in many different regions. And it's available on FedNet Go Help Desk in English, Russian, Arabic, Spanish, and French. So the guidance was really developed to provide information to staff and volunteers on how to engage, inform, and support older people during COVID-19. And this quiz is intended to be a short introduction to the guidance. So don't worry if you haven't looked at it in depth yet. We'll take you through the quiz, and then our colleague Nagore will give a short summary of the guidance. So this is not an exam, take it easy. What's going to happen next is a small pop-up window will appear with the questions and potential answers. Some are single choice, some are multiple choice, but I'll make sure to flag that before you give your answers. So if I could ask Margarita to kindly start the quiz. Great. So question 1. What is included within the interim guidance for Red Cross and Red Crescent staff and volunteers working with older people during the COVID-19 response? Is it guidance on how to engage and communicate with older people, key messages for older people that can be adapted to the local context, resources for further information, or the formula for COVID-19? So this has multiple answers, so please select all that apply. I'll give you a few more seconds to submit your answers, and then we'll see the results. Great, so hopefully everyone has inputted their results. Margarita, if we could see the answers. Okay, so yes, there are 3 correct answers here, the first 3. So it contains guidance on how to engage and communicate with older people. And then it has also key messages which you're supposed to take and adapt to your local National Society context as needed. And the last section of the guidance has resources for further information. Unfortunately, we do not have the formula vaccine for COVID-19, but maybe in the next version of the guidance, we'll see. Next question, please. So question 2, why is the guidance on working with older people called interim? So is it because there wasn't enough time to finalize it? Because the situation related to COVID-19 is constantly evolving? Because of a typo, did we not mean to put interim in? Or is it because we expect to update the guidance? So again, this is a select all that apply, so please select as many of the answers that you think are most correct. And we'll give you another few seconds again. Okay, Margarita, could we see the results for this one? Okay, so most of you got at least one of them right, because the situation related to COVID-19 is constantly evolving. So all of you put the correct answer for that. But also it's because we expect to update the guidance as the situation evolves and as we see what national societies need, we will input that in the next version. So question 3, please. So what is not one of the 4 recommended actions made by the guidance on how to work with older people in the context of COVID-19? So here only one answer is correct. So do we not want to engage, communicate, isolate, or establish regular check-ins? Or do we not want to observe? What doesn't appear in the guidance? Okay, I think we can display the results for this one now too. 100%, yes. So isolating is not one of the 4 recommended actions to take, but the guidance very much so does recommend to engage, communicate, and establish regular check-ins. Next question, according to the guidance, why may older people be more vulnerable to COVID-19? So again, here only one answer is correct. So are they more likely to have pre-existing conditions? Might they have difficulty caring for themselves and depend on family members or caregivers? Do they have a higher chance of having a weaker immune system and are more susceptible to infectious disease, or is it all of the above? Okay, hopefully you've had enough time to answer. Yes, so all of the above here are correct. There's a many constellation of factors that can increase the vulnerability of older people to COVID-19. And Banu went through some of those in his presentation as well. So next question. So according to the guidance, how might an older person's access to information increase their vulnerability to COVID-19? So this is specifically access to information. So older people have to stay in isolation to protect themselves from COVID-19, so they're not able to hear key public health information or how to protect themselves. Is it because all older people has physical, visual, auditory, or cognitive impairments and can't understand the information and messages that they receive? Or is it because older people believe that their own wisdom is sufficient to get them through the pandemic? Or finally, is it because they're less likely to use common communication platforms? So here only one answer is correct. Okay, we can see the results for this one now too. Okay, so this one was a bit trickier, but the correct answer was that they might be less likely to use common communication platforms. So what is not a key recommendation on how to communicate when working with older people during COVID-19? So please select only one answer here. Is it that you should use communication channels that are well understood by the older people you are communicating with? Is it that you should deliver key messages in the exact same way to older people in all context because consistency is key? Or should you base the information you share on trusted sources and not share rumors, or use visual or other aids to support delivery of key messages? So here you should select what you should not do. Sorry, the way I phrased that might have been a bit confusing, but what is not a key recommendation? A few more seconds. Great, we'll move on to the results. Great, so you should not deliver key messages in the same way to older people in all contexts. You have to take the information and key messages provided in the guidance and adapt it to your local context. And then the next question. So which one of these is not the recommendation in regards to violence, abuse, or neglect at home? One is it not a recommendation that staff and volunteers visiting the homes and answering hotline calls should be attentive to any potential signs of violence? Should you immediately intervene in any suspected cases of violence or abuse and question everyone in the household? Should staff or volunteers who are trained in supporting people at risk of violence use this knowledge and expertise to act? Or should staff and volunteers who are not trained but have concerns speak with their supervisors and seek advice? So there's only one correct answer for what you should not do. What is not the recommendation? I think we can display the results now for this one. So you should definitely not immediately intervene in any suspected case of violence, abuse, and question all family members. And then we'll move on to the final question. So last question, what is the best way for a national society to use the key messages included in the guidance? Should you copy and paste all the text and add the logo of your national society, tweeting it several times a day? Should you adapt and adjust the messages to fit the current local context and the priorities and existing services of your national society, then review these periodically? Or should you include all the messages, even those which promise support that your national society cannot give? And the results for this one, please. Last question. Yes, and almost all of you got it correct. You should adapt and adjust the messages to fit your context and capacities as a national society. So great job, everyone. Thanks for this. I'm going to pass it on to Nagore for giving the summary of the guidance. Thank you.
Thank you, Tika. I hope you can hear me perfectly.
Yes, loud and clear.
Yes. Okay, so yeah, I'm happy to see that you have already or read the guidance, or you're already aware of the main recommended actions on how to work with older people. I'm just giving you a summary on these 4 recommended actions. The first one is we need to engage. So you will find in the guidance some examples on the ways we would like to communicate, inform, get input or suggestions from other people, and how to engage them in the planning and implementation of the most appropriate responses for older people in your specific context and national societies. How to collect the feedback, how to be sure that we avoid isolation. So these are some of the suggestions that you could find under the recommended actions on engaging with older people.
The second one is communicating with other people. As you are aware, some other people may face challenges in understanding messages received from media or other resources. They might also have questions about the specific terminology we are using all over the place related to COVID. They might have physical impairments, vision, hearing, or cognitive impairments, which may require us to communicate in a different way and to be creative and adaptive as well. The third recommended action is establish regular check-ins. This is about monitoring how others are doing and if they need help. So in the guidance, you will find different ways in which we could do that based on the context and the situation we are in. The fourth action is observing. While giving specific services or doing home services, the idea is to check around that everything is in order and there is no sign of any problem. Could be while you are doing home visit, it could be dirtiness, could be darkness in the house. So just to this recommended action is just to be attentive to potential signs of abuse, violence, or neglect at home. There is also a section in the guidance about self-care of volunteers when supporting older people, and there is mostly around making sure that you follow the measures to protect yourself and that you look after your own health and well-being first before helping others. Then we go into the key messages for other people to be adapted for local context. So you will find key messages that you will need to adapt to your context and to your national societies. And it's mostly around what is COVID, how can it be spread, the do and the don'ts. So basic information that will need to that you will need to adapt to your specific contextualize to specific national society and the work specifically that you are doing. And then there is finally a list of additional resources that could support your work with other people. Within these additional resources, you will find visual messages that you could use, some other tools and guidance that you could have a look at to complement the work to support all the people. And then in the next slide, we'll have a look very quickly on the key points in the guidance from PGI perspective, protection, gender, and inclusion, that are classified around a PGI approach that we call DAPS, which is looking into dignity, access, participation, and safety. So we have input in some of the ideas under each of those areas, and I'm just going to give an example of one of them. So under dignity, we have to look to address and prevent stigma and discrimination. Is one of the things that we are looking into preserving and promoting the dignity of other people. In terms of accessing information and services, one of the examples that we could be looking at is use communication channels that are more adapted by older people, as we said before. When we go into the other area, participation, in the next slide, examples that how we can make older people participate in the response to COVID is make consultations as inclusive as possible by considering issues of language, accessibility, for example, timing or placement, and functioning. And for safety, as we said before, be especially vigilant for signs of violence during home visits. This we classify in these 4 areas, but these are things that has been included along the guidance and that we have already discussed, and that has specific PGI lens. And because, as you know, PGI, we are just looking for specific needs of specific people. Thank you.
Okay, thank you very much, Nagore and Chika, for giving us a brief update around the interim guidance. It was a very nice way to start with a quiz and then give a update. So you manage all of us to walk through it. Now, may I request Margarita to just explain us briefly around the breakout room discussions and how we can do it?
Yes, thank you so much. We are ready now to go into our small rooms. And this is the place where you will have the opportunity to talk and express your thoughts. Each room will have a facilitator and they will guide you through some questions that you will have to answer. There's a Google Doc. Chika will put the link to the document in the chat so you can all have access. And there will be the questions that you will be discussing in your breakout rooms. You will have some minutes, around 10 to 15 minutes, and we will let you know when we will come back to plenary. So the way that this happens in online is that I will open the rooms. You will get a link in your desk, in your monitor, and you just click there and you will be automatically transferred to your breakout rooms. So right now I will open all rooms and please go to the discussion with your facilitators. So you should be seeing one icon in your monitor, in your screen, that will allow to take you to your breakout room. So please go there right now. Thank you. So please, if you're still here in the main room, please try to see the icon to go to your breakout rooms. And Chika, please send the link to the WhatsApp also for the discussions.
I will do, Margarita. I've just put it in the...
Thank you.
Is there a way to send a message to the people in the breakout rooms? Because I think some may have missed the Google Doc link.
Let me see if I can send it. They won't be able to see the link.
If I send it to, let me just see. I've sent it to everyone here. But does this send to people?
But the facilitators have the link.
Yeah.
Right. So they can paste it in the chat in their small groups. Okay, you send it in. Yeah, good.
Yeah.
And then, how many minutes are we staying there? Then will you let me know when we're coming back, please?
Yes. Let me just double check.
Yeah, just let me know like 1 minute before.
Mm-hmm. Okay, we're 15 minutes, so we will be there until 10.
Okay.
I will let you know.
Hello, Nai. Michelle, do you have a group? Michelle, are you there? Hello. Hello.